Saco River Dentistry. Dr. Roy, Dr. Libby, and staff, patient Bonnie, Dave from BioHorizon, and we did a maxillary full chrome arch. Dr. Roy, it's his first case, and so I'm going to start with you, Dr. Roy. Could you tell us how was your experience with your first chrome case?
Sure. Not my first all-on-4 fixed maxillary arch. It's a bunny nose, but it's the first time using the chrome system. What time we got? It's early afternoon. We're all relaxed. We're done. That's not been the case in the cases I've done in the past. It's been 6 o'clock, 7 o'clock when we're finishing up. And we tend to finish up rushing it because we're trying to put the pieces of the chaotic puzzle together. Today, this was a very, very well orchestrated procedure. Everything fit every step of the way. Thomas is not paying me to say this. It really went very well. The pre-planning process of how this whole thing is put together is the reason why the treatment execution just goes as planned. Compounded by the fact that Thomas he's done so many of these cases, he was able to predict what we were going to run into before we ran into it and how to avoid that speed bump so that we had a very successful outcome. The complexity of this kind of case often lends itself to a very stressful situation. I would rather do this than doing some occlusal fillings. You know, it really is that predictable. Having the ability to place this and have it be aesthetically as we planned digitally was such a cool thing. The Roe Dental Lab has the preview software. I was able to send that to the patient ahead of time. She was able to approve it, and it looks just like it was in the photo. And that's just a testament to not only the technology we have today, but the lab's ability to use that technology and make sure that we're able to execute that in the patient's mouth. I've done cases like this where we deliver the denture and it's just not what we wanted. There's nothing more frustrating than spending 10 hours on a case and then having it look crappy.
Yeah.
We spent half the time and it looks 10 times better, and what a cool thing that is.
Excellent. Well, thank you so much. Dr. Libby, what is your experience? You kind of like were in and out looking at assisting from a kind of observation point of view. What did you think of the whole system?
Oh, the system's great. It was nice and smooth. It was nice to see that it's versatile and able to make adaptations throughout the process where we need to adjust, combined with the skill of you guys being in the room and him working on everything. It really just made up for anything going on. If we needed to change directions here or there, make an adjustment, it was simple. The system's made to work, and it did just that. She looks great.
Excellent, thank you. Ashley, you guys were assisting today. You've seen Dr. Roy do these cases. What did you think of it?
The efficiency was outstanding. Not only for us, the stress level, but for the patient. She wasn't in the chair, getting to that point of agitation, pain, discomfort, because she's not sitting there for long hours. Step by step, everything was the planning process was something that we're gonna take moving forward. For me, doing a lot of the prosthetic parts, I learned a lot today of what I can do to avoid some of the speed bumps, or some of the bumps, I guess, that we've faced in the past. So hopefully that's gonna turn around and help us moving forward.
Excellent, thank you.
As a pre-dental student, I think it was super awesome to get this experience. I think seeing the teamwork between all the doctors and Ashley and everyone was super great, and I'll never forget this experience.
Awesome.